The Trimboli method for back pain. This is complex, multiple reasons why your back is hurting you and debilitating you. Honestly, I don't have to tell you, you know. It took about probably 10 to 15,000 patients to start to figure this out. And now beyond 20,000 patients, I got this down. And I'm going to try to simplify it for you. How do you know if your problem is from a slip disc? Now let's keep in mind, this slip disc is also called a herniated disc. It's called a prolapse disc. It's called a bulging disc. It might even be an inflamed disc. Could be a degenerated disc. It could be stenosis. It could be disc degeneration, DDD, degenerative disc disease, degenerative joint disease, that's DJD. You get my point? There's 10 to 12 different terms for this, and it all is different variations of the same thing. How do you know if you have an acute, meaning a recent flare-up of a disc issue? I like to call them disc issues because it covers a lot of different variables. There's a lot of different ways to tell. Here's the top 3. Listen to the end and I'll tell you the best way to screw this up. And keep in mind also is that once you have a disc issue, the longer it's there, the more things layer on top of it. You could start with a disc issue and then muscles get involved, so you get muscle spasm and trigger pointing. And then on top of that, it could be inflamed. So you might have to look at all these videos to try to sort it out, or just leave me a comment. Maybe I can lead you in the right direction. But keep in mind, I'm not in the room with you. I can't diagnose, obviously can't treat, and you just have to use your own discernment and seek your own professional, qualified health professional, qualified to help you with this. How do you know if it's a disc issue? For one thing, after you've been sitting, and by the way, sitting is usually one of the worst things for you, especially sitting in the car. You can stand and you can walk all day long, but you go to sit and just that compression on that disc that's already irritated, the compression, gravity, the pressure of your body adds more irritation. When you go to stand up, here's a hallmark sign. You have to climb up your own body to get to standing. This is called minor sign. Don't worry, I won't test you on that, but this is what happens is you climb up. So that's 2 things to notice. Is it worse with sitting and better with standing? Do you have to climb up yourself? Is it worse in the morning? Textbook case scenario is you can sleep fine, you go to get out of bed, and you can't move, you can't stand up, you can't get out of bed. The other thing, a hallmark sign is you are crooked. You're either crooked forward or you're crooked to the side, and it's a kind of crooked that I can't mimic for you. It is a weird crooked. It is like somebody took you and just twisted you. And this is called antalgia, and it means that your body is looking for a position that's out of pain. What do you do? All right, there's a few things you can do at home. Ice, an anti-inflammatory supplement. We recommend a turmeric supplement. It's called Theracurmin. It is from Integrative Therapeutics. Ibuprofen does not touch this. It will have to be Aleve, and I don't recommend Aleve for more than 5 days. Ice, anti-inflammatory supplement, belt, meaning a brace on your lower back. The Sorolla belt, we love. We use it at our office all the time. It could also be the Bax Max belt, and you wear it 24 hours a day. Yes, especially when you're sleeping. Because the other thing you want to avoid is what I call the BLT, the bend, a twist, and especially if you're lifting something, bending, lifting, twisting, avoid all 3 and never do all 3 of them together. If you have a disc issue, that's a sure way to make a disc issue worse. The last thing, and most importantly, is seek the care of a healthcare provider, a qualified healthcare provider to help you with this disc issue. More than likely, that'll be a chiropractor. It'll be a chiropractor that does decompression or does a chiropractic technique called flexion distraction. Look for that, call around. I hope that helps. Bye for now. You want to know the best way to screw this up? You don't have to listen to me. What do I know? I'm just a crazy chiropractor doing this for 33 years and over 25,000 patients. And you might hear somebody tell you to exactly do what I'm going to tell you not to do. There's a whole method that is surrounded by this. And if you had a perfect spine, if this was a very short-lived, hadn't been there for very long issue, then maybe it would help. But that's not the person that I see in my office. And if you're watching this, you're probably not that person either. So I'm going to show you what not to do if you have a disc issue. Do not do anything where you're extending backwards like this. Do not do that. When we do your treatments in the office on the disc, we are bending your spine forward. We are putting you into the position that feels better because it's taking the pressure off the nerves. When you do what I just did, you are putting more pressure on the nerve roots and on the disc. Try it for yourself. If it messes you up, then you know. But maybe just don't do that. Need more help with your disc issue? Check the links below for more videos on how to work with it at home and what to do, what not to do, what stretches to do, and how to find the best chiropractor for you.